Now let's talk about the specific investigation. The specific investigation which we can do in atrophic rhinitis are the diagnostic nasal endoscopy, CT scan of the paranasal sinus along with X-ray of the paranasal sinus. These are the routine tests which are done in rhinology, and X-ray is not preferred, and CT scan is preferred more as compared to the X-ray, because in X-ray it can give false positive test of the paranasal sinus sinusitis. Along with these, saturine test can also be done, where we find that there is decreased nasal mucociliary clearance time. The culture and sensitivity of the nasal discharge can also be done, where we can find various organisms like Klebsiella ozyna, Proteus, E. coli, and Streptococcus and Staphylococcus, and we can measure the serum iron as well as protein level. Talking about the treatment of the atrophic rhinitis, it can be either medical or surgical treatment. Talking about the medical treatment, we know that the complete cure of the disease is yet not possible. However, the medical treatment, it aims at maintaining the nasal hygiene by removing the crust associated fetor and further prevention of the crust formation. The medical treatment, it involves nasal irrigation and crust removal. It can be done either by using warm normal saline or alkaline solution, that is alkaline nasal douche. In A&D, a teaspoonful of powder which containing sodium chloride, sodium biborate, and sodium bicarbonate is used in the ratio of 2:1:1 here, which is mixed in 280 milliliter of water. Here the sodium chloride, it makes the solution isotonic, sodium biborate makes the solution antiseptic, while the sodium bicarbonate, it helps to loosen the crust. The solution, it is run through one nostril and it comes out from the another nostril, while the patient bends forward and keeps saying K to close the nasopharyngeal isthmus. And care should be given to avoid the pushing into the eustachian tube and the sinuses. The irrigation initially is done 2 to 3 times a day, but later it is done once in every 2 to 3 days. And the hard crust are difficult to remove by irrigation, hence they are first loosened and removed by forceps or suction. After the nasal irrigation and removal of the crust, now it is painted with 25% glucose in glycerine, and it inhibits the growth of the proteolytic organisms which are responsible for foul smelling. The glucose, on fermentation, it produces lactic acid, which inhibits the growth of the proteolytic enzymes, proteolytic organisms, while the glycerin, it is hygroscopic in nature, so it absorbs the water from the surrounding and keeps the nasal mucosa moist. After that, local antibiotic is used in the form of spraying or painting, and it is done to eliminate the secondary infection. Local antibiotics like chemicitin antioxidant solution can be used, which contains chloromycetin, vitamin D2, and estradiol. The systemic use of streptomycin is also done 1 gram per day for 10 days to reduce the crust as well as odor, and it is effective against the Klebsiella organisms. Estradiol spray can also be done, which causes vasodilatation and increases the vascularity of the nasal mucosa and regeneration of the seromucinous glands. The placental extract, it can also be given submucosally in the nose, and it contains progesterone, which causes hyperplasia of the nasal mucosa as well as glandular secretion. The potassium iodide may be used via mouth and promotes and liquefies the nasal secretion. If there is no improvement via the medical treatment, then we move to the surgical treatment, and the surgical treatment is of various types like nasal closure or volume reduction, denervation, and salivary implantation. Talking about nasal closure, the nasal closure is done by Young's operation or modified Young's operation. In Young's operation, there is bilateral nostrils are closed completely within the nasal vestibule by raising the flaps, and it is only opened after 6 months or later, where the mucosa may revert to the normal and crusting is reduced. The advantages of the modified Young's operation is that here there is partial closure of the nostril is done, and it avoids the discomfort of the bilateral nasal obstruction. Here 3 millimeter of the hole is left so that the patient has less trouble of the nasal obstruction. The volume reduction is done, as in atrophic rhinitis we know that there is wide nasal cavity is present, so the air dries up secretion, resulting in formation of the crust. Hence, in atrophic rhinitis, volume reduction is done by various operations as follows. Lautenschlager operation, in which the section and medial displacement of the lateral wall of the nose is done. In Wilson's operation, there is submucosal injection of the Teflon paste is done. There may be insertion of the fat, bone, cartilage, Teflon strip under the mucoperiosteum of the floor and lateral wall and mucoperichondrium of the septum. Vestibuloplasty or the sublabial implant can also be done. Talking about denervation, it can be done by cervical sympathectomy, stellate ganglion block, and spinopalatine ganglion block. And salivary implantation can also be done. This was about the primary atrophic rhinitis. Now talking about the secondary atrophic rhinitis, here the etiology is known. The secondary atrophic rhinitis may occur secondary to infections like syphilis, leprosy, lupus, rhinoscleroma, and tuberculosis. It may also result due to long-standing purulent sinusitis or radiotherapy to the nose or excessive surgical removal of the turbinate. And here the investigation is done according to the suspicion of the cause, like chest x-ray is done in TB, bronchiectasis, and lung abscess. Mantoux test and sputum test is also done in TB. In serology like VDRL, TPI, and are done in syphilis, and nasal smear cytology is done in leprosy. And complement fixation test and biopsy is done in rhinoscleroma. The unilateral atrophic rhinitis, there is extreme deviation of the nasal septum, can be accompanied by atrophic rhinitis on the wider side. And the prognosis, the disease persists for years, but there is a tendency to recover spontaneously in the middle age. Now let's talk about the differential diagnosis of the dry nose. The differential diagnosis of the dry nose can be atrophic rhinitis, rhinitis sicca, Sjogren's syndrome, and radiotherapy. And the differential diagnosis of angina is found in atrophic rhinitis, foreign body in the nasal cavity, purulent sinusitis, rhinitis caseosa, and in case of malignancy. Now this is about atrophic rhinitis. I hope you liked the video. Stay tuned for more videos.